Suicide is an absolutely preventable form of death. What we often see with that person who expresses suicide acuity are three major components. We see someone who is experiencing extreme lonesomeness. They feel incredibly alone. There's a component of burdensomeness as well. That person feels like even if they were to talk about the things that are going on, the things that they're struggling with, it might not make things easier for them. The third component that we consider is the ability to acquire capability. And that can look a lot of different ways. It's not just about acquiring means. It could mean creating a state of mind where the act of suicide is more palatable. All of these different components, in the center is where suicide happens.
So in Douglas County, suicide is a pressing public health issue. Our most recent data tells us that it's the 8th leading cause of death for all age groups, and it's the 2nd leading cause of death for ages 15 to 44. While the data and the personal impact is very sobering, it's important to know that suicide is preventable, and we can all play a role in that healing and prevention by talking openly about suicide, supporting people who are struggling, and really working to build stronger systems of care.
Suicide often impacts the entire community in a way that might resemble waves. There might be ripples that continue to span out across a community, so that initial suicide death very often is not the end of tragedy.
We know for every death by suicide, there are many more attempts, and there are even more folks struggling with thoughts of suicide. So it's something that impacts many lives, often quietly, and can definitely have a ripple effect through families and communities.
That's why it's so important for us to be hands-on with a community after a suicide loss, be able to, in so many ways, those same things that we do for intervention end up coming back for a prevention or a postvention kind of mindset.
So while every person is different and every situation is different, there are some common signs that we can look for. For example, if someone is talking about wanting to die, if they are expressing feelings of loneliness or isolation, if they express that they feel like a burden to their friends or family. There can also be behavior changes like withdrawing from family or friends or activities they used to enjoy. Engaging in self-destructive or risky behavior could be another. And there can be situational factors too, like a recent major loss or relationship struggles or recent trauma.
Now we can think about how a person might express suicide acuity. That's more often an indirect sort of warning sign. Someone might say something along the lines of, pretty soon you won't have to worry about me anymore. Getting rid of cherished objects from their childhood, who's also maybe sorting out their responsibilities, figuring out who's going to care for mom or what's going to happen with the kids or who's going to take care of my pets. Someone changing schools and having to move, a divorce, a death in the family. These are all things that we want to be mindful of.
So if you're worried about someone that you care about, one of the things you can do is ask directly about suicide. And that can feel scary. There is a common myth that by asking about suicide directly, you're putting that idea in someone's head. But what the research shows is that it's actually the opposite. If we ask about suicide in a caring and non-judgmental way, we actually open the door for healing and connection.
The more you see, the more you know. If you're starting to see 3, 4, 5 warning signs from someone, that might be an indication that their acuity is high. And our responsibility in that moment is to ask directly, kindly, openly about suicide.
It really tells that person that they are not alone, that you're there for them, and it opens up an opportunity for you to connect them to support.
Douglas County as a community is really in so many different ways, whether that's from our local nonprofits, to our health department, to our law enforcement officers, have prioritized mental health and suicide awareness in a way that I'm so incredibly proud of.
In 2018, our community identified behavioral health as one of 4 priority areas to focus on in our community health improvement plan. At that time, we set a goal to reduce the suicide mortality rate by promoting prevention, integrating our service system, and improving access to safer suicide care like including initiatives like Zero Suicide. And recently, we've just recommitted to those priorities and goals in our most recent version of our Community Health Improvement Plan.
We've seen our law enforcement officers prioritize a co-response model. We've seen our hospitals prioritize mental health screening in an efficient and robust way. We see our local community mental health center, Burton Ash, invest in the crisis continuum in a way that so few other mental health agencies have. All of this together has created a more robust system where when you walk in through one door here, there's the potential to be connected with so much more.